And good evening, ladies and gentlemen, and welcome to the 2023 Facebook Live presentation of the Your Health is Important talk show. We are here to answer your healthcare questions. I am Dr. MJ Collier, host, producer, and on-air personality, and we appreciate you for being here with us. We know you have choices. We've missed you, haven't seen you since last year. So welcome back, welcome home. Let's get ourselves healthy. Let's get ourselves together. It's time to make it work. So we're announcing right now Dr. Collier's 6-week Get Healthy Weight Loss Challenge. So we have a Facebook group, Lipo Cares. Go to Lipo Cares and sign up. We're going to monitor your weight loss. We're going to give you all this free information. You register for the Pinpoint Plan on the Lipodrops website. So go to lipodrops.com right now. Get signed up for the Pinpoint Plan. Again, with that, we're going to monitor your weight loss. We're in it with you for the next 6 weeks. We want to see how everybody can do. You can give us as much or as little information as you like. You can keep it all to yourself. You can say, I want to lose 10 pounds. We don't know where you're starting from. We don't know where you're ending from. We just want to know whether you have success. Or you can literally take pictures of yourself standing on the scale and then document the date and the time. And then let's see where we are, what we're doing, how quickly you're losing, and how quickly you're responding with the Pinpoint Plan. The Pinpoint Plan is the opportunity to lose the most weight in the shortest period of time, and that's where we want to go. Of course, the beginning of the year, everybody wants to lose weight. Everybody wants to be the best that they can be. People are joining the gyms. Then some people have already quit the gym. They started going, and they found out that going to the gym, one, is not where you lose weight. Going to the gym is where you get fit. So when you're doing that, and you're going to exercise, you'll get in better shape, but you may not lose weight, because to lose weight, you have to expend 3,500 calories to lose 1 pound. Now, the average enthusiastic weight loss, 1 hour of exercise, a very good potent workout will burn 800 calories in 1 hour. Now, if you're working out 4 times per week, that'll get you about to 1 pound. That'll get you to about 1 pound. But most people, they set up a schedule. They work out in the gym twice a week. With the twice a week workout, you're literally setting yourself up for failure, because you have to have a workout program that is a minimum of 3 times per week, but optimally 4 times per week to accomplish your objective. So what are other things that we need to do to get ourselves healthy? Let's talk about some of those things. One, get yourself a primary care physician. I literally had a patient ask me today, I'm young, I'm healthy, do I really need a primary care physician? Guess what? They were following up after being seen at the local urgent care. So they go into the urgent care and they told them, you might have this, you might have that. So you need to find you a primary care doctor and get yourself evaluated. So that pretty much answered the question. I said, you can go to urgent care and they'll tell you what might be wrong, but they're not going to do anything about it. And they're not going to treat you. If it's not an urgent need or an urgent problem, then you're not going to be treated. It's the same thing with the emergency room. The emergency room determines basically whether you're at risk of losing life or not. Once they have determined you're not dying, they're not going to do anything for you. They're going to say, find your doctor or follow up with a primary care provider. That is where you get your health care. That is who decides and determines how healthy you're going to be. So you need to have a good relationship with a doctor that knows you and with a doctor that you know. The time to meet your physician is not in the middle of the night in the emergency room. That is not the time to establish a relationship with your doctor. They need to know who you are. So when they call Dr. Collier and say, my patient, Mr. Jones, is in the emergency room, I say, oh, Mr. Jones, he's got high blood pressure, diabetes. And they say, well, his EKG looks like this. I say, oh, his EKG always looks like that. There's nothing going on with him. Or I say, oh, that's a dramatic change in his EKG, and it's totally different from it was the last time I saw him. So something's going on, and we need to consider this a bit more urgently. That is the benefit that you get from having a good relationship with your doctor. So you establish a primary care physician. Then you establish a regular follow-up period. That can be for a lot of people, it's the first month of the year or the first quarter of the year. They schedule those appointments. For other people, they schedule them the month of their birthday. And so you can do it first of the year, first quarter, the month of your birthday, some other point in your life that's significant, like an anniversary, or the month a child was born. Something that will be consistent, something that you will remember, and something that will say, okay, it's my little baby's birthday. It's time for me to go get my complete physical. Those things you can match together and optimize your health. Next, set a regular bedtime. We are sleep deprived here in the United States. We're not getting enough rest. Now, ideally, you want to get 8 hours of rest. That is darn near impossible if you work for a living. So if you work for a living, you're not going to be that way. If you can get 6 hours, you'll get enough rest to sustain yourself. So that's what you want to get. If you can get 6 hours of rest, then you'll be good. You'll be better. The problem is that we're staying up Netflix and we're watching, we're streaming something, and we say, oh, I got to watch one more episode. I got to watch. Next thing you know, it's 2:30 a.m. and you got to be up at 6 or 6:30. You know you're going to be sleep deprived. And you say, well, I'll make up for it on the weekend. You cannot store sleep. You cannot save sleep. You cannot catch up on rest. So you need to make a conscientious effort to decide, I'm going to get a minimum of 6 hours of sleep every night. I'm cutting off everything at least 30 minutes before it's time to go to bed. Do not check emails. Don't go on social media, because the frequency of light on your devices, on your cell phone, on your tablets, on your pads, on your computer, tells your brain it's time to wake up. It tells your brain it's daytime. So it resets your sleep cycle, and you won't be able to go to get to sleep and get restful sleep for at least 3 hours when you do that. So it's important to put yourself in appropriate sleep mode. Dark, quiet room. Cool room, not warm, not hot. Dark, quiet, cool room. All devices off, no ambient noise in the background. Some people say they need music to go to sleep. That's not what you need. You don't need anything that's going to stimulate your brain. So you need to make yourself comfortable. Okay, so we're going to do the 6-week Dr. Collier Weight Loss Challenge. We want you to go on Facebook, join the Lipo Cares Facebook group, document your weight loss, how you're benefiting. Go to the Lipodrops website, sign up for the pinpoint plan right now. 6 weeks. Let's see where we're going to be in 6 weeks. That's basically the end of February. So you can get your sexy on before Valentine's Day. You got a month basically to lose as much as you can lose, so you can fit into that outfit that you want to fit in. So men, so you can tighten up that muffin top. We are always talking about how we want the ladies in our lives to look. We need to take a look in the mirror and see what we're looking like as well. You want to be an attractive mate. You want your spouse to be turned on by looking at you as well. You want your significant other to look at you and say, wow, he's hot. I got to get him. That's what you want. You want to be that way. You don't want to have a 12 and you a 5 or a 6 because you got Dunlap. Your belly's hanging over your belt line and it's Dunlapped over. You want to be the best you that you can be as well. Not to mention the fact that you function better. You have more stamina. You're more sexually superior the smaller your abdomen is. When you got a big stomach, you can't lay on your back and and have successful intercourse because you don't have enough blood pumping to your man parts. So then you're limited by the things you can do to enjoy yourself when you're with your partner. So we want you to be the best you can be. Ladies, we want you to be the best you can be. We want the children in our lives to be as healthy as they can be as well. I saw that they are now the FDA is going to approve some of these weight loss injections for adolescent children, I think down to age 13. So that's going to be a dramatic change in how we're treating obesity in childhood. So one of the things we're going to talk about as well. Okay, you know the deal. Let's do roll call. Where are you logged in from? What part of the country? Your name. We want to see if some of our regulars out there. Then we're going to get to answering your question. Happily, let's do some roll call. Makiba Boland, Happy New Year from Douglasville. Thank you, Miss Boland. So good to see you as well. Sherry Gamble from Dallas, Texas. Thank you, Sherry. Good to see you as well. Sean, Big Time Green, my hero. Glad to see you, Sean. I really appreciate you hanging in there. Sarah Davis from St. Louis, Missouri. I love St. Louis. Thank you. Sabrina Washington from St. Louis also. Sabrina, thank you. Starlet Oliver, hello and Happy New Year as well. Happy and happy. Miss Audrey Shanae from New Orleans, thank you so much for logging in. We really appreciate seeing you. Felicia Regina Sermons Cunningham. Felicia Regina Sermons Cunningham, Happy New Year to you too. Thank you very much. Brenda Johnson Rand from Sheffield, Alabama. Thank you, Brenda. Valerie Patterson from Nashville, Tennessee. Okay, we got the South covered. No, let's see who we got in. Janae is from West Palm Beach, Florida. Now we're talking. We're going down the East Coast. Let's see what we got. Winnie King, good evening, Winnie. Thank you so much for logging in. We appreciate you. We know that you are a regular follower, and we appreciate you for taking the time out this evening. Okay, Estelle Oliver, Lithia Springs, right here close to Dr. Collier's office. Thank you, Estelle. Charlotte Brown from Brookhaven, Mississippi. All right. Thank you. Nivea Jesus or Jesus from Detroit. Detroit. I love Detroit. Boulder City. Felicia from Jonesboro, Georgia. Hi, Felicia. Thank you. Okay. Tam, Scorpio Finest West. Thank you, Tam. Missed you. Thank you. And again, Miss Audrey Shanae Ingalu from New Orleans. Thank you. Janae Allen, West Palm Beach, Florida. We got you. Keisha Fuchs from Madison. Okay. Jacqueline Ramona Webster from Las Vegas. You may be the first person from Las Vegas that we've had. Thank you so much. Nicole Anthony Shavers from Birmingham, Alabama. Nora Martin from Jacksonville, Florida. Winnie King once again. Okay, let's get to the questions now. Austin Chase from Atlanta, Georgia. We got somebody from Hot Atlanta. Very good. I want to see North Carolina, South Carolina, New Jersey, New Orleans. Okay, Renee Frazier says, I've never had the outbreak of eczema that I'm experiencing now. I'm seeing a dermatologist who have prescribed an ointment. Could there be something internally that is causing this? Absolutely, Renee. Sounds like you may need to be evaluated for food allergies. The amazing thing is that the science of allergy testing has evolved so substantially. They can literally take one drop of blood. They can do a finger stick on you, put it on a card, send that card to the lab, and that lab will analyze you for indoor allergens, which will include dogs, cats, mice, moles, funguses. Outdoor allergens, which is basically virtually every tree, grass, and pollen in the area that you live. And then food allergies, everything from milk to eggs to shrimp. The number one appetizer, shrimp. It amazes me when people are allergic to it, but I've had people that are allergic to steaks, beef, to pork, to chicken, to fish, salmon, to tuna, and virtually every food you can think of. The entire food allergy panel was positive. So one of the things you would do to treat that is to take some probiotics. So go to the Lipodrops website, get the Lipobiotics, and that will change your life. You start taking it twice daily, one in the morning, one in the evening. Within weeks, you will notice a dramatic change in how your body responds to any allergen. So your eczema will improve, your asthma symptoms, if you have asthma, and any listener that has asthma, if you have itchy eyes, your skin breaks out. If you get bubble gut after eating, you're not sure what it is. It's because you have food allergies. So a lot of people are misdiagnosed as in gluten intolerant, irritable bowel syndrome, all these nomenclature diagnoses that there's no actual test for. It's just what the doctor decides to call it. And when all you really need to do is take some probiotics, and you can improve your allergy, asthma symptoms, as well as your GI discomfort. Flatten that tummy, stop that bloating when you're eating. Get those probiotics. Probiotics will change your life. We have a thing called the belly plan, where you can take the probiotics and the lipo cleanse, because the probiotics will stabilize the gut flora, putting the good bacteria in your gut. The lipo cleanse will clean out all of the bad stuff. The lipo cleanse is not a laxative. I don't want people to think they take it and they're going to be on the toilet all day. That is not what it does. What it does do is allow you to have large, easy to pass bowel movements that will detoxify your gut, detoxify your body. So the lipo cleanse and the probiotics are a great compound comparing to improve your GI and allergy health. Okay, great question. Charlotte Brown, okay. How are you? Thank you very much. Is it safe to take Lipodrops and Mounjaro? Absolutely, Charlotte. As a matter of fact, when using the Mounjaro or the Ozempic in my weight loss patients and my diabetics that need to lose weight, I will oftentimes have them on an intense weight loss program that includes the Lipodrops, the Keto Max, the Lipo Cleanse, because the Lipo Cleanse, sometimes the Mounjaro and the Ozempic can give you either constipation or diarrhea or both. But the lipo cleanse stabilizes your gut. So when you take the lipo cleanse and the probiotics, you don't get a lot of the potential GI side effects that you can get with the Mounjaro, particularly once you start to get to the higher doses. But I think that is going to be weight loss of the future. The Mounjaro FDA is now going to approve it for weight loss strictly. Right now, the Ozempic, it has a weight loss indication, but not under the name Ozempic. The exact same drug is marketed as Wegovy, Wegovy. It's literally the exact same medication made by the same people, but under the name Wegovy is for weight loss. Under the name Ozempic is for diabetes. And people with diabetes, it lowers the blood sugar, lowers and stabilizes the A1C, and makes them lose weight. So everything that you need when you're diabetic, you get with this class of drugs. Okay, next question. Is black currant oil and pure brown seaweed extract good? Menopause, how to lose weight. Okay, both of them are good. I endorse both of them as good supplement options. Uh, they are good for a variety of things, but weight loss is not top of the list. They can help, particularly the black currant oil with menopausal symptoms. But to lose weight, again, you need to go to the Lipodrops website, get the Lipodrops Maximum Strength, get the Keto Max, and maybe the probiotics or the lipo cleanse or both. Those four things together is the optimal weight loss objective, to lose the most weight in the shortest period of time. And that is where you should go. So go to lipodrops.com right now and get those things to accomplish your objective of weight loss. One thing about it, as you lose weight and you have less body fat, your menopausal symptoms will improve as well, because the interaction, neurohormonal interaction between hormonal receptors that are in lipocytes or fat cells, they decrease. There's less of them when you lose weight. And that's one of the things definitely with the Lipodrops. You lose the muffin top, you lose the right type of fat with that product, and it's going to help improve menopausal symptoms as well. Great question, Sylvia. Jacqueline Ramona Webster. I have a loved one who's been diagnosed with a brain tumor. What kind of foods can be incorporated in order to combat? Okay, so natural foods. One of the problems with any type of tumor is that tumors occupy space and cause inflammation. The body's natural anti-inflammatory, vitamin D, is the best drug. As soon as a person is diagnosed with a tumor of any type, first thing they do is place you on vitamin D. Guess what? If you're already taking vitamin D, you won't get the tumor. But if you do have a tumor, malignant or benign, then you would take the vitamin D at a dose of 5,000 international units per day. That is the simple, most elegant way to minimize your body's chance of turning a cell of some sort, like you see in tumor, into a malignancy. So natural anti-inflammatories, again, vitamin D is the best. There are others, of course, other supplements you can get, from curcumin to turmeric. There are other things that you can take. However, the thing that's easy and elegant is the vitamin D. As a matter of fact, if the person has not been taking vitamin D, I would start off taking 10,000 international units a day for at least a month, and then go down to 5,000 for maintenance purposes, just to build up my vitamin D level very quick. Initially, vitamin D is good for strong bones, strong teeth. So if you got a low vitamin D, and everybody does, you got weak bones. That means you fall down, you'll break something, break your shoulder, break your wrist. The most common fracture is falling down. You stretch your hand to catch yourself. You break your arm at the wrist, and you either dislocate or fracture your shoulder. And then if you just go down on your bottom, you break your hip. Now, nobody dies from a broken hip. What happens, though, once you stop moving around, you end up catching a pneumonia, and you die from the pneumonia that basically is a result of breaking your hip. So let's keep these bones strong. Everybody wants to get, the bone scans and the DEXA scans to determine if they have, weakened bone density. Cut out the middleman. Doesn't matter what the scan shows. Take the vitamin D and optimize your bone health, and then you'll be better regardless. Because the only thing that happens if you get a DEXA scan is it's going to say you have demineralization and you need to take vitamin D. So regardless of that outcome, just take the vitamin D, and it doesn't matter what that scan shows. Then you're already treating the problem and you're strengthening your bones. Great question. Okay, Bonnie Culberson Woods. Hi, Bonnie. How are you? From St. Louis, Missouri. Will the Lipo Max cause an increase in blood pressure since it has caffeine in it? Lipodrops Max does not have caffeine in it. It has no stimulants in it. So you can take it regardless of what your disease state is. No high blood pressure, no diabetes. None of those things are contraindications to taking the Lipodrops Max. It has no stimulants, including caffeine. It has protein burners, things that allow your body to, amino acids is the word I'm searching for. It has amino acids in there that allow your body to more effectively metabolize fat, and it's got vitamin B12. That's it. So there's no caffeine in it. Let's get that myth gone now. That is not on the ingredients list, so you don't have to worry about that. So no increase in blood pressure. But even so, let's talk about the myth that caffeine increases blood pressure. People with high blood pressure can drink coffee safely. There was a study that showed people drinking up to 8 cups of coffee a day, and they had benefits from that, regardless of their disease state, high blood pressure, diabetes, virtually anything wrong with them. That actually was a good thing. So it's not necessarily from the caffeine, though. The caffeine It's not the key ingredient. There's some other things that are inherent in the coffee bean per se that actually help your health, and as far as a general overall your body's metabolism, etc. So it's not the caffeine per se, but caffeine is not necessarily bad for you. I don't want it to get a bad word, but the key point that we're making is there's no caffeine in Lipodrops Max. Okay, great question. Freddie B, how you doing, Freddie? Any of your products safe for breastfeeding moms? Just about the vitamin D, Lipo Omega. All of them are safe for breastfeeding moms because none of, even if they got in breast milk, they're only good for the baby. So the vitamin D in particular, but the omega-3 and all those things, if they cross the barrier and get into breast milk, that shouldn't have no negative effects. The lipobiotics go straight to your gut and change the bacteria in your gut. And if the baby was lucky enough to get some of that, then all they would do is have better GI health as well. When babies are born and they're having the yellow stools show that there's not enough bacteria to help metabolize food. That's one of the reasons you don't give them solid foods, because they are incapable of digesting them. Bacteria plays a key role in the digestion of your foods, and the more crunchy the food is, the more substantive the food is, the more you have to chew it to digest it, the more stomach acid it takes. So let's say red meat, pork, things like that, the more difficult it is to digest. So that is why you don't give those things to babies. Over time, the baby's gut will develop its own bacteria. That's when the stools change from yellow to green to brown, the normal color. And that means they have now a normal gut bacteria. When babies were drinking cow's milk, they would get a lot of this good bacteria because it's in cow milk. The problem is that other things, the cow proteins, etc., cause asthma, allergies in babies, and a variety of other things. So when they make artificial formulas, you lose a lot of those good things that you were getting, particularly the probiotics in the milk products. You still get the vitamins and all those things, but you're not getting the probiotics. Okay, next question. Estelle Oliver, I'm having hot flashes in my body. To my touch feels hot. I was tested that my thyroid is overactive. Is this symptom for the thyroid not functioning properly or just menopause? I'm 60, had a hysterectomy in 26 partially. Yes, and yes. You can have both. You can have hyperactive thyroid that can cause those things. And if you do have hyperactive thyroid, that needs to be treated to stop overstimulation of your metabolism and a rapid heart rate. You can have a condition called thyroid storm that is a medical emergency, but for most people, they don't get that. They just get a rapid heart rate. Their body feels warm because they are warm. Their metabolism is burning fat and burning, period. Most people like that because they lose weight, and so they're happy with it until they find out either they can't stop losing weight or that they're having other symptoms that they ultimately find out are thyroid. Again, one of the reasons that you go to the doctor, get a comprehensive physical examination before you start a weight loss program, before you end the weight loss program, before you start an exercise program, because you can get a full thyroid panel. Do not just let the doctor get a TSH. That is a thyroid stimulating hormone screening test that doesn't tell you half the information that you need about your thyroid metabolism. So you need an FT3 and a T4 as well as a TSH to evaluate fully and completely your thyroid. Now at age 60, you're definitely going through menopause, regardless of whether you had the hysterectomy or not. In 2006, partial mean they just took your uterus and they should have left at least one ovary in there. That is by definition what a partial hysterectomy is. So that being the case, you probably had hormonal function up until now, and now you're at the point where you need to have that evaluated. So the problem is that the doctor that treats the thyroid most effectively, the endocrinologist, is not going to deal a lot with your female hormones. And the OBGYN that's dealing with the female hormones is not going to work a lot with the thyroid unless they understand the connection between the two and are willing to take on that challenge. So, but most of the time you got two doctors that aren't communicating with each other, that are not giving you optimal care. So you need somebody coordinating this thyroid storm and this menopausal hormonal blast to get your hormones straightened out. You need to be evaluated for bioidentical hormone replacement therapy, BHRT. Google that. And I perform that service in my office. If you're not in the local Atlanta area, I literally have people that have watched this broadcast, have flown in from Chicago, Detroit, Florida to get this done. But it is probably available in your local area. But this is life changing. This makes you look and feel young again, makes you the person that you were, and you just a better person by getting your hormones coordinated and normalized. So that's the thing. So BHRT, bioidentical hormone replacement therapy. Find it, just say BHRT near me and see what pops up. Okay, good. Janai Allen, thank you. I received a bike for Christmas. Is bike riding better to be in my cardio? Is walking best? If you feel comfortable riding the bicycle, the only problem with bike riding is the danger of falling. Bike riding is good because you're not supporting your weight. It is a great exercise, but so is walking. I don't want to ever make people think they have to have an apparatus to obtain cardiovascular health. The only thing you need is a place to walk and the right shoes to walk in. And you don't have to have $300 super Nike, Adidas, New Balances. It can be just a good shoe with good arch supports and some good socks that support your feet and walking. And you just get out. What's important with walking is the time that you do it. So a minimum of 30 minutes, not the distance, but a minimum of 30 minutes, you can do it for an hour. I advocate for my patients, particularly my female patients, walk in a controlled environment like a mall. Just leave your purse in the car. Don't have the ability to go spend money on a whim. Don't have the ability to stop at the food court after you've walked and you burned maybe 600 calories during your walk, and then you go and eat 1,200 calories of American cookies or Cinnabons or something like that. So just make the walking your only point at the mall. Most malls will allow you to come in before they open. I have a lot of mall groups that go out like 9 a.m. The mall opens at 10, and there's only people in the mall are walkers, and they get out before any of those stores open. And or in the evening when the stores are closed, you can walk around the mall. The great thing about mall walking, doesn't matter whether it's hot, cold, raining, snowing, wet, dry, whatever, you can get in there and get your exercise in. It's always good to have a partner, a walking buddy, a friend, male, female, parent, children, anybody that you can get as part of your process, so that even more than one person, so that when one of you say, oh, I'm tired, I'm not going to do it tonight, they say, come on, girl, let's go walk. We got to get our walk on. That's what you want to do. So walking is good. Bike riding is excellent as well. But again, be careful of the type of surface that you're walking on. Be careful of traffic, and, avoid potholes, etc. Because, having a bike accident is no fun. It always results in substantial and significant injury. Okay, great question, Janae. Veronica Denson, good evening. So glad that you are here tonight as well. I had an abscess in my throat. Any suggestions? The abscess, if you had an abscess in your throat, meaning it's resolved. Most of the time, a throat abscess will spontaneously rupture, and that fixes the problem. That's what God does to these things before doctors get involved. But I have had situations and circumstances where I have literally had to take a large needle and drain an abscess in the back of someone's throat. It gives them instant relief, as well as sometimes it can compromise your breathing. And so you have to have it basically decompressed on an urgent and or emergent basis. Others, I have literally had to take a scalpel, take a tongue depressor, take a scalpel and punch the abscess, and it squirts pus everywhere, but then it instantly is treated as well. The treatment of an abscess is to open it and drain it. Most of the time that fixes the problem. Sometimes the body's amazing and remarkable ability to heal will reseal the abscess capsule, and it will recur. Taking one abscess and treating it doesn't mean you won't get another abscess immediately adjacent to it. Abscesses are common, say in the underarm area, for people that are particularly ladies that shave under their arms, and they take that razor and they go up and they shave backwards against the grain, and then they get irritation and an abscess under their arms. That's called hidradenitis, and it is again treated by usually antibiotics and hot compresses, but sometimes you have to open it up and drain it, even pack it with packing, and then allow it to heal by what's called secondary intention over time. Great question. What do you think is the primary cause of foot pain in the bottom of my feet, specifically in the center and instep area? Okay, great question, D-Long. Inappropriate shoe fitting or the need to wear arch supports. Sounds like the feet are actually supposed to be in an upward bridged posture, just like my hand folded here. But over time, those bones can relax and the foot starts to flatten out, which looks perfectly good and normal, but that's not the posture that the foot is supposed to be in. It's supposed to be arched like that. And once it gets flat, you start to get pain in the foot. You can also have the foot tilting in or out. And when that happens, that also throws off. So one of the simple solutions is a lot of stores now have foot departments, and they have this machine that you can literally stick your foot in, and it takes a mold of your feet, and it analyzes your posture, and then it suggests certain types of shoe inserts that you can get. And you may get total and complete relief by doing something like that. You just go to the Dr. Scholl's section, pick out you may pick one that say, okay, maybe I need to pick a stronger or more supportive one or whatever. You can also go to a foot specialist, a podiatrist. Podiatrists deal with basically everything from the legs down, including particularly the knees, but always the feet. And they can do a custom mold of your foot, tell you exactly, and create orthotics or inserts that are unique to you, that correct whatever your immediate deficit is in an appropriate way versus coming close to doing it, which is what you're going to get with the store-bought models. But you can see by doing that whether you're approaching a good, is that the process. Now there's some other issues that can go on in the foot as well. There's a condition called plantar fasciitis. That's where the wrapping around the muscles in the foot, that's kind of like saran wrap, gets inflamed and irritated, oftentimes because it's being stretched, or it can get dried out and torn. All kinds of issues can happen with that. Plantar fasciitis can be a curse, and that is literally what Tiger Woods is suffering from right now. And he can't walk the distance of a golf course. He'll start off feeling fine, but as time goes on through an 18-hole round, he starts to get severe pain in his feet. So, hopefully he's getting to know his chiropractor, his podiatrist very well, and they are working to come up with some orthotics that will give his feet the support that they need. Good luck with that. Go to your friendly neighborhood podiatrist. Google podiatrist near me. If not, like I said, you can start off with something simple, get you some inserts. They have solid inserts, they have soft inserts, they have rubbery cushion inserts, they have inserts that have air in them, all different types, one of which will probably be one that will give you some relief. Okay. Also a foot massage. Don't hesitate to get a foot massage. Okay. Derek Kendricks, rather. A Lipodrops safe to take while on high blood pressure medications? Derek, absolutely. As a matter of fact, they help because as you lose weight, your blood pressure becomes easier to control. Now, I would never tell a person that they can come off the blood pressure medication when they lose weight, because you can lose a dramatic amount of weight. Some of my worst, most difficult to control hypertensive patients are skinny as a rail. I like to call them Ike Turner thin. They are really lean people, but their blood pressure is sky high. But for the vast majority of people who got some extra weight to lose, losing as little as 10 pounds can make a major difference in how you respond to your blood pressure medication. But Lipodrops contain no stimulants, do not alter the blood pressure, do not make it go up, do not make it come down. What makes it come down is the weight loss that you get from using the Lipodrops, but no contraindication with any high blood pressure medication. Remember, you put the Lipodrops under your tongue. This is where it works. You hold it under your tongue. It is absorbed as efficiently as if you had gotten a shot of the exact same medication. It is literally the same medication that is used as an injectable in weight loss clinics. And so we came up with the Lipodrops because people now don't have to go to the weight loss clinic every week to get a shot. They can use the Lipodrops, get the same benefit. Follow a pinpoint weight loss plan or some weight loss plan that's on the Lipodrops website. Use the Lipodrops and you will lose the weight. All right, great question. Stacy Anderson. I need to know the best way to deal with pain and inflammation because of psoriatic arthritis. Okay, Stacy, psoriatic arthritis, a couple of things. One, autoimmune disease. There are now immunological medications that will give great relief to that. The traditional method is, of course, oral steroids. The problem with oral steroids is that they make you gain weight. Two, they can make you have diabetes. If you already have diabetes, your diabetes will get worse on long-term steroids. So you have to come to a compromise. But remember your body's natural anti-inflammatory, vitamin D, and then omega-3 fish oil kind of oils those joints. And also it has anti-inflammatory benefits as well. So for a person like you with that diagnosis, I would definitely have them on the vitamin D, 5,000 international units per day. the Lipo Omega, 1 capsule in the morning, 1 capsule in the evening. You actually might even have to go up to 4 capsules, but those are standard every day. You do that. And because there's inflammation, and the probiotics help with inflammation of all of your body, but particularly in the gut, those three things, Dr. Collier's trio for good health, every day, all day. I take them every day. And again, those are the things that will help your body fight these things naturally. So again, look at some of these new immunological therapies. There are pills, there are injections. They all have amazing benefits, but they also have some, but because they compromise your immune system, you are more susceptible to various types of infections. But with the natural anti-inflammatories, that is not a case. So vitamin D, omega-3 fish oil, again, even the probiotics, that is in addition to, not instead of. You still may have to take an anti-inflammatory such as Motrin, Advil, Aleve, Naproxen, ibuprofen, meloxicam or Mobic, Siloxybid or Celebrex. Any of those things can also give relief. If you're on a blood thinner or have some issues with stomach ulcers or gastritis in the stomach, then you may only be eligible for Tylenol. But understand this, even arthritis strength Tylenol is not an anti-inflammatory. It is just strictly to help with the pain. That is why if you have inflammation, you treat inflammation with anti-inflammatories. And that is what gives you the most relief. That is what also stops you from getting continuous damage to your joints, because psoriatic arthritis does real damage to your joints. It doesn't just make them swell and hurt. It does breaks down the bones, and you end up with the bony deformities. And that's not what you want when you can avoid that, or even avoid it totally, or prolong or minimize the amount of damage that's being done to your joints. You want your hands to look like this. You don't want your hands to look like this. That can be a problem. That's very difficult. They don't function as well. You can't grasp things. You pick up a cup of coffee or a glass of water, you drop it, and it's not as attractive. Even though you got your nails done, etc., your hands aren't as attractive as they would be if you didn't have those problems. So let's take the time. Now, there's no instant cure for this. This is going to be a partnership over time. But if you get those natural anti-inflammatories, a couple of months from now, you're going to be calling in like tonight. You're going to be talking about how much better you're feeling. I promise you. Okay, next question. Marlene Labreda Kennedy. How long should you do intermittent fasting? I'm going to try the 16-8 fasting. Marlene, that is a very good question, because people were saying do it for 4 weeks. People were saying do it for 6 weeks. People were saying do it for 3 months. Then there are people that adopt it as a lifestyle. And so it's technically not intermittent fasting. It's just the way that you eat from that point forward. So this is a very easy to do weight loss program, which basically means you eat everything you're going to eat in either you fast for 16 hours, you eat everything in an 8-hour period. That means no substantive foods. You can drink water, sometimes other things, but don't drink cheap calories. Your body does not recognize liquid calories. They don't give you a sense of satiety. You don't get full. You can drink a whole gallon of sweet tea. You can drink a 2-liter bottle of soda. So, but it's a lot of cheap calories in there. And so you're blowing the entire fast by what you're drinking. You're doing the right things as far as food is concerned, but you're not losing weight because you're drinking too many things, too many calories. So be careful when you're in your fasting period. I would say really just drink water, some of the flavored waters that have 0 sugar and 0 calories. I have found these to be attractive alternatives. In most places now, I find that you can get, they're basically $1 a bottle. You can get 10 for $10, and I'll usually get 15 to 20 of them and keep them in the refrigerator. And when I would have reached to grab something else, I either drink regular water or I drink one of those flavored waters, and the satisfaction level is there. Okay, great question. Okay, Tam Scorpio, I'm so glad that you have a question. I know someone who has had bariatric surgery. With good advice would you give them? Depending upon when they had it, one and what type of bariatric surgery. There are several types. There's the total and complete gastric bypass, which reroutes all of your plumbing. There's the gastric sleeve. The gastric sleeve basically takes your stomach, which for most people at that point in life, the stomach is swollen to about the size of a 2-liter Coke bottle. About the size of a 2-liter bottle. Envision that. They take it and fold it upon itself until the actual space and surface area of the stomach is about the size of a banana. So you have less surface area to absorb calories, and you have a sense of satiety. You feel full quicker. So that is how that works, and it works wonderfully. They call this either the sleeve or the gastric bypass the surgical cure for diabetes, because there have been cases of people that were very difficult to control diabetics. They got this surgery, and by the third day, they were off their insulins because of other neurohormonal function between the stomach and the pancreas that are fixed, blocked, or corrected by this surgery. And so, people that are diabetic, not only now do they not have the diabetes, but they start to lose dramatic amounts of weight. The problem with that is that the gastric tissue is living and breathing tissue. So they chop it down to, they fold it down. It's not chopped, it's not cut with a gastric sleeve. With a gastric bypass, they chop it down to about the size of a plum. But if you keep eating, you can stretch that small space out, and eventually it can become the size of a 2-liter Coke bottle again. That's when you see people that get the surgery, they lose 100 pounds, 120 pounds, but 2 years later, they're back up to where they were. That is very damaging to the body in a variety of different ways. The simple things is it stretches your skin. Now you have skin folds, skin flaps, and you're susceptible to skin infections, which most of the time are just a bother, but actually can become a problem, make you septic, and create other issues. But the stress on your bones, the stress on your GI tract, all those things result in poor health. And so your risk of your cardiovascular risk factors increase exponentially if you lose weight and then gain it back. So I tell people all the time, my objective with the LipoLine weight loss plans is not to see how much weight we can get off you in 3 to 6 months, because we can get almost any amount of weight off of almost anybody in that short period of time. If they do everything we ask them to do, they'll lose weight. It happens. The problem is where you're going to be 6 months after that. We want you to sustain the weight loss. That is the benefit of altering your metabolism. So calorie restriction works, but it won't keep working. And most people start eating around it because they just start to crave foods. I tell everybody there's a hormone in your body called ghrelin. Ghrelin the gremlin, I call it, because ghrelin tells you that you're not full to keep eating. And when you start to lose weight, the level of that hormone in your body keeps going up and keeps going up and keeps going up until eventually you can't resist it anymore. It is not you having poor intestinal fortitude or you can't stick to anything. That ghrelin literally makes you eat, and it tries to make you eat to get back to whatever your starting weight was. The problem is you get back to, you lost 20 pounds, you gain back 30, because it doesn't stop once you're at 20 pounds. It takes a while for it to come back down and get back to where you were. So most people will gain more than they lost originally. That's why it's very important to have a maintenance plan in your diet so you can keep doing that. So one, they have to make sure a person with bariatric surgery that they're getting all the vitamin supplements, because they lose the ability to metabolize and absorb B12. So B12 deficiency is very frequent in patients with bariatric surgery. They have to be careful about taking anti-inflammatories because they can irritate that small space. They're not digested as quickly. You can't put a lot of fluid in there to dissolve the tablets. So the tablets sit on the stomach lining and basically just burn and irritate it like an acid, and it can give you stomach ulcerations and cause even a GI bleed. So those are the things to be avoided. Make sure you're taking a complete multiple vitamin with iron and minerals, because you cannot absorb all of your iron and B12 supplementation separately. Ideally, a sublingual B12 under your tongue, just like the Lipodrops, which will help you maintain your normal vitamin levels. Great question. Okay, Judith Craig, what do you recommend I could take that's better than the metformin for pre-diabetes? One, metformin will be my first choice. So there's not much better for pre-diabetes than the metformin is. There are other medications that you can take, virtually anything else in the diabetic regimen. SGLT2 inhibitors are good. Those are your medications like Jardiance, Farxiga. There's one called Steglatro as well. Then there are DDP4 inhibitors that you can take. Tradjenta is the name of the one name brand that you can get. Those are good as well. But again, for prediabetes, if you can tolerate it, metformin is the best product. Metformin comes in 500 milligram and 1,000 milligram tablets. The problem with metformin is a lot of people can't tolerate the 1,000 milligram tablets, and there are doctors that will put you on two 1,000 milligram tablets. Take 2 in the morning, 2 in the evening, guaranteed to basically cause you to have GI upset and most likely diarrhea. The most effective regimen with metformin is a low dose 500 milligram tablet, but taken 3 times per day with each meal, breakfast, lunch, and dinner. This is a European model that was started in Germany and found to be very, very effective in controlling blood sugars and lowering A1Cs in individuals, taking you out of that pre-diabetic range and putting you back in the normal range without the GI upset. Again, the standard therapy was 4,000 milligrams per day of the metformin, and that's why a lot of people couldn't tolerate it, and they have to try other things. But with the 500 milligram dose of metformin 3 times per day with each meal, breakfast, lunch, and dinner, you should get a great response to it, lowering your hemoglobin A1C, lowering your blood sugar, taking you out of that pre-diabetes range. Now, 2 things about metformin. Metformin comes in an immediate release formulation, or IR, or an extended release, XR. If you have difficulty with the metformin, get the XR formulation and take it mid-meal. So start eating, take the pill, full glass of water, finish eating, and you shouldn't have any GI problems with that, particularly with the extended release formulation, the XR formulations. But the IR is the most common one. It's one in Atlanta. We have a grocery store chain called Publix. They were giving away the metformin for free. So if you got a prescription for it, you could get it up to a 90-day supply at no cost. But it was the immediate release formulation only, not the extended release version. So, but again, at 500 milligrams, most people can tolerate the metformin with no GI side effects and get the benefit that you like. Metformin also has other positive effects. It's an anti-aging medication. It slows the aging of your body on a cellular level. So there are places where people that don't have prediabetes or diabetes or anything like that, but they take the metformin to slow down the aging process. That slows down a condition called apoptosis, that is cell death, on a programmed period of time. Cells, various types of cells, live for various periods of time in your body, and the metformin slows that process down. So it's like anti-aging, and so a lot of people take it for just that reason. It's the #1 most prescribed drug in the world for the treatment of pre-diabetes and diabetes. So if you can tolerate it, there's nothing better. Okay, great question. Bunny R. Culberson Woods. Will the Keto Max increase my blood pressure if I have hypertension? The Keto Max will not. Keto Max also has no stimulants in it. None of the lipoline products are contraindicated in high blood pressure. None of the lipoline products are contraindicated in diabetes. None of the lipoline products are contraindicated in thyroid disease. So all of those conditions, you can safely take these supplements without hesitation. There's no medication that they're not compatible with, no issues, no concerns. So you don't have to even think about that when you're taking this. A great question, because everybody thinks that things that, particularly when you see the word Max, people think they have stimulants in them, and there's so many medications and supplements over the counter for weight loss that have stimulants in them. But the lipoline was developed particularly to be safe in those individuals, people with high blood pressure, people with diabetes, people with high cholesterol. You can safely take any of the lipoline products with no issues. Okay, great question, Bonnie. Neve Law, what do headaches and nosebleed are a sign of? The 2 things aren't necessarily congruent. Particularly if you can have headaches with no nosebleeds, you can have nosebleeds with no headaches. But if you got both of them, it's high blood pressure uncontrolled until proven otherwise. There are other things, like you can have sinus headaches and sinus issues that have nothing to do with your blood pressure, but just the when you get the headache, it's more frontal sinus headaches. There's sinuses above the eyes, the frontal sinus, below the eyes, the maxillary sinus, and right between the eyes, straight back about 2 inches in, called the sphenoid sinus. Any of them can become fluid-filled, pressurized, and cause pain. And then if you're congested, you're blowing your nose too aggressively, you can get nosebleeds, but you can also just spontaneously bleed your nose. So uncontrolled blood pressure would be my first choice, but then sinus issues would be my second. And I would treat either and or both in taking care of this. But if you're having that complication of headaches and nosebleeds, you definitely want to get your blood pressure evaluated, because that would make that a medical emergency. Sinusitis and sinus bleeding with headaches is more of just it's just uncomfortable, unpleasant, but it's not going to kill you. But if you having high blood pressure high enough to give you nosebleeds, then that puts you in probably the status of malignant hypertension, and you're at risk for a cardiovascular event. Okay. Next question. What can I use to treat toe fungus under the toenail? Okay, Wayne, there are several things. One, an antifungal cream such as chlorotrimazole, which is available for $1.25 at the store that used to sell everything for $1, but now it's $1.25. They just have it in a brown box that says antifungal. You can buy it by the case. I always get $5 worth, which is 4 tubes, and keep it around because it will treat fungus under your arms. It will treat fungus in your inner upper thighs or jock itch, and it will treat toenail fungus. Now, the problem with toenail fungus is, depending upon how much of the toenail is involved, a topical anything. There's stuff that you paint on the toenails called fungi-nail. It's like clear nail polish that will help superficial fungal infections, but not a deep fungal infection. So you can soak your foot in a solution of Clorox bleach, or in just a small amount of Clorox in warm water. Soaking it will help as well. But there are pills that you can take that are antifungal that you can take for as little as 2 weeks or for as long as 3 months, depending upon how long you need to take them, because nothing that you do to treat fungus changes fungus nails to normal nails. Nail tissues are dead tissues. The fungus lives on the dead tissue. So what happens is the treatment arrests the new growth of fungus, but then the old fungus has to that nail has to grow out. Now, how long does that take? Some people's nails grow as little as 1 millimeter a month. Other people's nails grow 5 to 7 millimeters a month. So if your nails, fingernails, or toenails, are fast growing, you could be through with this in 8 to 12 weeks. If they're slow growing, it may take 6 weeks. May take 6 months rather to do that. But either way, you can have normal nails. The great thing about the oral therapies, the pills, is that they set up an antifungal barrier under your skin from your head to your toes. So that means you're not susceptible for fungal nail infections for quite a long time once you stopped taking the medication. But the objective is to relieve yourself of the possibility of re-getting it. And so that means keeping your feet dry. I like to, and I read this in a men's magazine, and I highly recommend it to anybody. Instead of trying to shake powder on your feet and on your toenails or put cream on there, you take your socks, turn them inside out, put the antifungal powder in the sock, turn it back into right side in, and then put the socks on. That keeps your feet dry and fungus free. And that's just a part of your regular, when you get dressed, that's what you do. Make sure you change socks daily. If your feet sweat, you may need to change socks more than once a day. If you have shoes that have been contaminated by fungus, you can't clean them out. They can't be fixed. You just need to get new shoes. Otherwise, your shoes, particularly work boots and steel toes and things, will keep reinfecting your feet. Tennis shoes, I don't care whether they're the $300, $400, $500 Nike, Air Force, whatever's. If they're contaminated with fungus, you need to get rid of them, or you're going to be suffering from fungus. And oftentimes the fungus infects the skin of the foot along the bottom of the foot in what's called a moccasin-like pattern. That moccasin pattern is a fungal skin infection. Then you also get infection of the nails. And what starts off as just a minor annoyance and a cosmetic problem can result in major issues if it gets a bacterial infection in there. You end up, your toenail coming off, or you losing your toe or half your foot, particularly if you're diabetic. So it's very important to maintain good foot health. And when you go to the doctor for your complete physical, make sure you take your shoes and socks off. Doctor needs to look at your feet. Okay, great question. Trisha M.O.B. Is sea moss good for PPL with autoimmune disease or any type of herbs? The sea moss is good for that, but I think probiotics are better. But sea moss have a probiotic benefit, but they're not probiotics. But sea moss is good, but you can do both. I've had people that take sea moss as well as probiotics and have had dramatic responses to autoimmune diseases, in doing so. There are other herbs. Black seed oil is one that's recommended as well. Sometimes when you have an autoimmune disease, you need to go to a place where you can have a counseling session with somebody who knows about supplements. Most of the large places like the Vitamin Shop and GNC, they actually have people that are trained to make recommendations based on what you have. But again, I tell my patients, supplements are just that. They are in addition to whatever prescription medications you may be on, not instead of. Don't say I'm going to take CMOS instead of my anti-inflammatory steroids, because you may need the steroids to get it under control. Once it's under control, you may be able to maintain normalcy with supplements, but oftentimes you'll have to do both. And so when autoimmune is just, a bad thing, because it's basically when the body is attacking itself. Your immune system doesn't recognize normal tissues that are you, and it starts to attack them, just as if you had a blood transfusion that doesn't match, or you got an organ transplant that's not you, that doesn't match you. And so you start to reject it. So your immune system is rejecting your body's normal tissue. It can be your stomach, it can be your lungs, it can be your skin, it can be your muscles. Any tissue is susceptible to an autoimmune attack. And so very important. That's why steroids calm down the immune response and help so dramatically with that. The problem again with steroids is, again, if you don't have diabetes, they can make you become diabetic. If you're pre-diabetic, you're virtually guaranteed to become diabetic. If you're already diabetic, it makes your diabetes much harder to control, and they result in weight gain. And I don't know why. Steroids have no calories in them. They don't necessarily alter your metabolism. I don't know whether they make you feel like eating more or whatever, but you do gain weight when you're on steroids, invariably. So one of the things you have to be conscientious about. Okay, great question. Austin Chase, I want to lose 40 pounds. My goal weight is 125. How long should I give myself to safely lose this weight? That means you're at 165 now. You signed up for the Pinpoint and the Lipodrops Max and Cleanse. The question is, Austin, where we're starting from, and whether 125 is a reasonable weight for your body size. When you're 18, it may have been. When you're 40, it may not be. You may be better at, say, 135. 25-pound weight loss is achievable and sustainable. Losing down from 40 from 165 to 125 and staying there, you can do it, but the question is staying there, and that's what's going to be difficult. And it just may not be the weight that you need to be at. A mature woman's body should not be 125 pounds, particularly if you've had children. It's just not going to look good on you. But more importantly, if a woman of color, you have what I like to say is a black woman's blessing. You have breast, hips, and thighs. These are good things. And so getting down to a weight of 125 pounds when you have breast, hips, and thighs as a blessing, very difficult to obtain, and more importantly, very difficult to sustain. So ideally, I can just, if this your profile picture, if that's you, then I would say 135 is probably a better look for you. But if that's you, and depending on what your starting weight is, there's nothing wrong with the weight that you're at. 165 pounds is not a bad weight for a woman. It just depends on how tall you are. So we'd have to calculate your BMI. You can do that on the Lipodrops website. But you can use the Pinpoint plan. Let's see what you do. I want you to join the Lipo Cares Facebook group, and let's monitor. Let's see how you do. With that, you should lose a minimum of 10 pounds a month. If you just follow the Pinpoint weight loss plan, you may lose up to 15. It just depends. You may start off losing real good. You may lose 15 pounds the first month. You may not lose but 10 the second month, because your body starts to fight it. And it's just easy to lose it initially. But then it's the last few pounds that are most difficult to lose. And so, again, we need to be a part of the group so we can give you more information. You're going to get so much free information if you participated in Dr. Collier's weight loss challenge that will really make a difference in where you are in 6 weeks. So you can, in 6 weeks, you could have lost 20 pounds easily. Let's see if you can be halfway to your goal weight by then. Let's see. Great question, Austin. We appreciate you. Sharisha Russell. Hi, Sharisha. How are you? So many supplements on the market, in addition to a multivitamin. How do you know what supplements are essential, beneficial to take? Well, not just a multiple vitamin, Sharisha, but a complete multiple vitamin with iron and minerals. A vitamin is a fixed chemical formula. There's no better way to make it. So if you can't get 100 vitamin tablets for under $10, you're paying for a pretty bottle, or you're paying for a celebrity endorsement, one or the other. But vitamins are a fixed chemical formula. When you go to the store and buy, you'll see a name brand, and it'll say, take this vitamin 1 a day. And then it'll have the store brand and say, compare to take this vitamin once a day. And then you get the store brand because it's literally the exact same thing, and you'll save a lot of money when doing so. And so they'll say, compare to multiple name brands of vitamins. So get that. But then make sure, again, Dr. Collier's trio for good health. Vitamin D, 5,000 international units per day. Omega-3 fish oil, at least 2,000 milligrams per day. That's one capsule in the morning, one capsule in the evening. And then omega-3 fish oil, then the probiotics, which is one capsule in the morning, one capsule in the evening, and the vitamin D. Those three things. Those three things will give you basically everything that you need to optimize your health. That, along with a complete multiple vitamin with iron and minerals. As you stated, many supplements on the market. The thing with supplements are they're only as good as the person that's manufacturing them. They need to have quality controls in place because, the FDA has done studies on products. Some products have nothing that they have advertised in the bottle is actually in the capsules that you're taking. Others, they have a lot of fillers, particularly rice powder can be in these formulations. So you want a product that actually is exactly what it says it is on the bottle, that's purified, make sure it doesn't have contaminants in it. And to do that, you have to have high quality controls. The Lipodrop product manufacturing process is very, very significant, and it makes sure that we have quality controls in place. That is why these products are not the least expensive products on the market. There are cheaper products, but there's no product that is better, and no product that is better per amount of money that you're spending. So you definitely want to make sure that you're getting a quality product for the money that you're spending that does exactly what it's supposed to do and contains exactly what it's supposed to contain. So great question, Sharisha. Sharon Davis, can you recommend how to use Lipodrops for a person 63 years old needing to lose about 20 pounds? Yes, Sharon. Lipodrops once, twice, or 3 times per day. Under the tongue, hold under the tongue for 2 minutes before your meals, and depending upon how quickly you want to lose. Again, some people want to slow down the weight loss. They don't want to use a lot. Once you've lost the amount of weight, oftentimes you can just maintain using the Lipodrops once a day. And so I put the Lipodrops, after I brush my teeth in the morning, I put the Lipodrops under my tongue and hold it under my tongue while I'm shaving. Once I finish shaving, I either swallow it or spit it out. But my point being, once a day is great for maintenance purposes. Weight loss, definitely 2 to 3 times per day. Again, before your meals, holding it on your tongue. Age is not a factor. Again, there's no restrictions on weight loss as you're aging, and this is a very easy way to do it and a low risk way to do it, because oftentimes when you're in your 6th decade, you may have health challenges like high blood pressure, like diabetes, like high cholesterol, or you're on other medications that you have to be concerned about, drug interactions. No drug interactions with the Lipodrop product line. Good to go with any medication that you're on. Okay, great question. Okay, my ear constantly itching today. I've tried ear oil and peroxide that hasn't helped. Okay, you have what's called seborrheic dermatitis. That is a contact dermatitis of the ears that's caused by dandruff coming off your own hair. And so 1, don't wear your hair over your ears. 2, use an anti-dandruff shampoo when you wash your hair, like Selsun Blue, or even that you can get a generic version of the Selsun Blue that has a selenium in it that will help control that. There are, directly to the ear proper, you can place hydrocortisone cream, 1%. That is also available in the store where everything was $1. Now it's $1.25. Again, small amount on the Q-tip swab. Use the Q-tip swab with the peroxide. I wouldn't put oil on there because it's probably aggravating the problem. The peroxide, and then use the hydrocortisone cream as your moisturizer so the ear is not dry. And then again, do not wear your hair over your ears. And when you wash your hair, use an anti-dandruff product. Okay, so look, we have run out of time. We have had a phenomenal session here today. As always, we are so glad that you tuned in today to this Your Health is Important Facebook Live product. We have answered your questions. We have enjoyed talking to you. 2 things. 1, join Dr. Collier's 6-week weight loss challenge. Go to the Facebook page, join the Lipo Cares Facebook group. Let's talk about, let's participate together. We want to know how good you're doing. It's always best when you have support, when you're in a group of people that are doing the same or similar goals. You support each other, you have a better outcome. Thank you so much. We're going to have a phenomenal 2023. There's going to be less of D in 23. We're going to be healthy. We're going to be happy. Thank you, Havlik, for a great show. Thank you for screening the calls. Thank all of you for tuning in. We'll see you next time on the Your Health is Important Facebook Live broadcast. Dr. MJ Collier, we're out.